David, Happy New Year.
Happy New Year to you.
Yeah, that's great. So we're here early in the year, and it's a good time maybe to think about what's going to happen in 2011 in healthcare, and particularly what's going to happen for employers, and what you think and what PBGH thinks you need to do about it, because it's going to be a challenging couple of years as we go forward. I mean, it's exciting in the sense that we've got health reform bill passed, but we've got a new Congress which has got its eyes on repeal and replace. Maybe we'll start there. Maybe we'll just start at the big picture and the political stuff and say, what difference does it make basically that we've got, the House now controlled by Republicans who have really come to power in the House on the back of the fact that the public, they claim, dislike Obamacare.
Yeah. Well, I can't parse the logic of the election or the outcome of it, or obviously predict the future. I do think there are features in the bill that are potentially very valuable for people trying to control healthcare cost and improve quality. And there are things that we fought to get into that bill, and we hope will survive whatever politics comes along this year. And frankly, I think the employers are going to have to step up and defend some of the elements of the bill that have the potential to improve the healthcare system. Because if we don't all work together to find some drivers for efficiency, affordability, and quality, we're all going to be sunk together. So I do think the fear of just tearing apart the bill and leaving us without any of the tools we need to manage cost would be a very unfortunate outcome to this political season. And frankly, we hear a lot from people in the White House and the government. They need employers to step up and say what it is do employers need to make the healthcare system perform better. And if the employers stay in the background during this political process, we're going to have other stakeholders who have a very strong interest in how this plays out being in Washington 24/7, and our voice won't be heard. So I hope that employers are going to listen to those debates and look for opportunities to speak up. So the things that I think they have to speak to, we've got to innovate around payment. We've got to pay doctors to produce high quality care, pay hospitals to produce high quality care. To do that, we've got to measure what is good quality care. So we've got to defend the efforts to standardize measurement, make public availability of information so that we can pay people for what works. We've got to invest in finding out what works and holding people accountable for doing what works. So the evidence, this Comparative Effectiveness Institute that was formed, called PCORI now, is something I think it's potentially a political target, but it would be very unfortunate if we lose the ability to measure what works. So there are some really value-producing targets, payment, transparency, effectiveness research, that we've got to defend.
No, I think that's a very important point, because certainly, as you know, I have this partnership with the Harris Poll and the Harvard School of Public Health, and we've surveyed a lot of the different stakeholders, and the irony is that while the public, about 40% of the public in the recent Harris Poll said they would like to repeal some or all of the bill, when you actually ask them about, well, what bits of the bill do you want to repeal, they don't want to repeal any of it in a majority, except for the individual mandate. And I think that's partly just the fact that there is complete absence of willingness to sacrifice among the American public. But you make a very key point, which is that the elements in the bill that are employer friendly or consistent with the goals that PBGH have of a higher performing health system that's more affordable particularly for the private sector employers, in the absence of them stepping up and saying, we need to have these tools, the void will be filled by other people with other agendas, is basically what you're saying.
Well, and reality is those tools that potentially will help us manage costs and improve quality could come out of the hide of somebody else. There's going to be some affected party who doesn't want to see more transparency, doesn't want to compete on quality and value. And they're going to be at the table saying reasons why we shouldn't go down this road. So we just have to be realistic about the politics of this, and it's going to be important for those who care about improving the affordability of the health system to get in there and say so.
And wouldn't you say, just to build on that point, that particularly in this climate now, particularly given that the White House has rumored to be bringing in more corporate types to try and bolster their relationships with the private sector, this is a perfect opportunity for employers to be engaged with the policy process and reinforce the fact that we really do need to do some of the stuff that's in Obamacare. It's not perfect, but repealing it and sort of starting de novo would be a very bad idea.
Well, I think the pain that we've all felt through the recession period, and that is compounded for people who have lower incomes, who are very dependent on their health care coverage. We have to keep in mind those people really need good, affordable health care.
Right.
And if we just unravel the toolkit we have to begin to create affordability in the healthcare system, what is going to happen to these people and to the companies that employ them. Our competitiveness globally is at risk, and just the welfare of our public is at risk. So if anyone has a better solution, a better tool, we're all ears. But we've got a few things we think are going to be effective, and we need to get behind them and implement them.
Right. And I think that's a very important insight, is that build on what's positive rather than emphasize what's negative. And that's a good counsel for employers
So,
generally.
one other thing I want to add about this general theme is a lot of what's in the bill that's important to us is the opportunity to innovate. We've had a very stagnant, kind of arthritic healthcare system for a long time, and we need to see very talented people in the healthcare system given a reason to do things innovative, creative, patient-centered, community-based, home-oriented, technology-supported. All those features of a more dynamic, contemporary healthcare delivery system, we've got to support that, incentivize it. And the bill provides some of that. It gives Medicare the latitude to do innovative things in partnership with the private sector,
Right.
and on a regional basis. So we're thinking, come to California, let's bring the Medicare program, the Medicaid program, the private employers, the health plans together, and do some new things to improve affordability and quality. And the government now has the latitude it never had before to be a partner in that, bring all their money and political influence to bear. So we want to take advantage of that opportunity in 2011 and 2012 and make some things happen.